Welcome to another episode on dental malpractice. My name is Charles Buse and I'm a dental malpractice lawyer. And in today's video, we're going to be talking about a significant yet often overlooked complication that can arise during dental procedures. I'm talking about subcutaneous emphysema. This occurs when air is forced into the submucosal spaces, which can lead to swelling, and it can potentially escalate into life-threatening issues. Subcutaneous emphysema occurs when a dentist uses the wrong handpiece during a procedure. Some handpieces use compressed air, and if that compressed air is directed down into the tooth and surrounding tissues, it can force air into facial spaces where it does not belong, and that air can become trapped, and it can even spread around to the neck and other areas of the body. In a nutshell, that's what we're talking about when we're talking about subcutaneous emphysema in the dental context. So how do we spot subcutaneous emphysema? What are the symptoms? Well, the first sign of subcutaneous emphysema is often tissue swelling. Unfortunately, this can mimic other complications or even normal and expected swelling, at least at first. However, subcutaneous emphysema often comes with a very unique symptom, and that's the presence of a crackling sensation when pressing or manipulating the swollen tissues. It is also important to be on the lookout for other symptoms like a fever or sweating, which may indicate infection. If subcutaneous emphysema is suspected, a thorough and immediate examination is necessary. Symptoms like changes in vision, voice, swallowing, or breathing abilities, and even chest pain could signal complications that require immediate transfer to an emergency room. This is because these signs might indicate nerve compression, ischemic eye issues, or even life-threatening air embolisms in the brain or heart. So how do we manage this condition? Fortunately, subcutaneous emphysema is usually self-limiting, and it can sometimes be managed conservatively. Often, antibiotics are used to prevent potential infection, because that's one of the more serious dangers associated with subcutaneous emphysema. If you can imagine, the air forced into the tissues is likely carrying with it a host of bacteria, and those spaces can quickly become infected. More severe cases might require surgical intervention. It's often recommended that patients with subcutaneous emphysema should avoid actions that increase intraoral pressure, like smoking or blowing their nose. And the pain associated with this condition can often be managed with over-the-counter pain medication. As for recovery, folks with less serious complications can often get completely better within a week or two. However, those that develop more serious complications may take much longer to recover. Well, that's all I have for you today. If you or a loved one has experienced subcutaneous emphysema and developed a serious complication as a result, you may be entitled to compensation. Please don't hesitate to give us a call. We offer free legal consultations and we handle dental malpractice cases across Florida, Georgia, South Carolina, and North Carolina. All you have to do to schedule a consultation with us is call the number below in the video description, or you can visit our dental malpractice page at www.carelessdentist.com. Thank you so much for watching this video, and we'll see you next time.